Wonderful. Good morning. My name is Dr. Vladimir Gashinsky from Holistic Dental Center, and I want to just interview a wonderful professional who I know for many, many years. I met him, then he trained the dentists to become naturopathic doctors. He gave a wonderful presentation, and since that time, we start working together. I use his remedies in my office, and he's working on new ones. He's going to tell you more about it. And I want to present you Kenyon Keily, and he's going to talk about himself because I need him to tell his full name, his status, degree, his expertise, and how you can get everything there.
All right, please. All right. So my name is Kenyon Keily, and I work as an herbalist, which I've now been doing for over 40 years. So I think my expertise is coming from the actual work I do. I'm one of those people who's self-taught. So I did go to a couple of long-term programs. One was an Ayurvedic program. And then what I have done in my life is find practitioners who know more and go hang out with them and pester them until they let me sit with them. And then I would learn from them. And then I've learned from the patients, and I've learned by studying. And when you have a passion for what you do, you never stop studying. It's your life.
Absolutely correct.
Right?
Absolutely correct.
Just your life. So where am I located? I'm actually located on the internet by telephone. Should I give my phone number?
Why not? You know that people want to connect with you and they want to talk to you.
So if they want to reach me, the number is 978-618-2130. Text me, phone me. So at the moment, I'm in Minnesota, and I'm here setting up an extract business for my herbal formulas. I'll also be back in Massachusetts. I'll also be back with you sometime to hang out again in New Jersey. So I'm mobile at the moment, and I do all my work through internet and phone, which leaves me a lot of freedom to look at the world around me.
Wonderful. Yes? And tell me about your expertise to diagnose the patient, just taking the medical history and look at their tongues.
Yeah, so the way that I go about doing what I do to gather information is I have people send me tongue photos. If I'm sitting beside you, I always want to look at your tongue. I want to look at the upper surface of the tongue. I want to look underneath the tongue. And by looking at that, I get an idea on the organ systems of the body, which organ systems are struggling, which ones are doing okay. And I have also a 10-page intake form that you fill out, which isn't quite as daunting as it sounds. It's just checking off items, and then I can look at that and make a comparison between the tongue and the intake form. And that gives me the information I need to then develop which formulas are suitable for the conditions a person needs to be treated for. So a little bit of the difference for me is people come with a disease name, but I always feel like that just tells you a little bit of information. What matters is the person. How do they present? Which organ systems are struggling? Because that's the foundation. The disease is just a name overlaid on top of that. So the depth of my gathering is to actually tongue diagnosis, and if I get an opportunity, looking at the complexion, their face, how they walk into a room helps, how they stand, how they talk, the sound of their voice. So there's a lot of factors that you can use to gather the information on how the person, how the person is presenting. Yeah?
Yeah, I know exactly what you're talking about. After I learn you, I look at my patient and just asking you, tell me about your digestive problem. How do you know? I just learned from you.
So the thing about the tongue is it reveals your physical well-being, your mental, your spiritual, your emotional. Everything is revealed by the tongue. And so I enjoy it very much working with people in this way, because in about 5 to 10 seconds of looking, you can have a 15 to 20-minute conversation with someone about what's going on in their life. It reveals very, very quickly. And it's one of the things I like very much to teach people is how to look at your own tongue so that you can understand how to prevent a condition continuing or turn the corner and steer away from something that's probably going to get worse if you don't take care of it. Most of the work, I think, is on the person to eat healthfully. So I have a lot of opinions about what that looks like, but it's actually very simple. All right.
And I understood basically you need intake form from a person who want to contact you, which I filled many years ago, and we're constantly in communication. And you need to look at their tongue. You need a picture from the phone, and after that you have some kind of communication. You recommend herbs.
Correct. Yes, we have a 1-hour consultation, and by the time we are complete, I send them a list of remedies that I want them to take. So some of those remedies are my own formulas. So they'll be very specific to the patient, and sometimes the formula is only for that person. It isn't like a pre-made formula. Some of them are pre-made because I have, for example, 3 liver remedies that I use, as opposed to having just a single liver remedy. Because we have conditions that are heat, so it gets very simple. So I tell people, hot, cold, wet, dry. That's something that is really important to me. And they go, question on their face. And I go, well, just think of the weather. It's hot, cold, wet, or dry. So inside your body is the same, hot, cold, wet, and dry. And within a short look at the tongue, you can tell what's hot, what's cold, what's wet, what's dry. Right? So we have conditions like red tip tongue. Red tip tongue means person probably doesn't sleep well, probably means they have anxiety and anxiousness. If they have markings and scalloping at the edge of the tongue, it usually means that they worry a lot. So it's not like I'm a magician so much as I learn these things and they apply. They're basically in all traditional medicine. So for me, the biggest question is, what would nature do? When I'm working with someone, I'm always thinking about what would nature do? How would nature approach this? It's not really technical in the end. It's very simple. So simple that people, I think, overlook it, Vladimir. They think it's too simple, but it's, as you well know, it gives you a lot of information that allows you then to treat the person.
What made you to come to study herbs?
What got me started, eh? So a couple of things. There's one thing which I will say goes back to my childhood. When I was maybe 5 or 6, I have these memories of following my father around, and he was trimming up the plants. He was, doing the garden and cutting the bushes back. And as I came around the corner, I noticed him doing this. I felt the pain from the bushes. I can't explain it any other way. And I started touching all the cut pieces that he had done, all the cuts, so that they would calm down. And I remember him looking over at me and he goes, "What are you doing?" And I go, "Of course, what would any kid say? Nothing." Right? And so he just turned back and he kept going. And I waited till he wasn't noticing me, and then I kept touching all the cuts so that they would stop hurting. And then I gathered all the cut pieces and I took them down to the backyard and I started planting them again. And I remember him coming round the back and he said, "What are you doing?" I said, "Well, I'm planting them," right? And he said, "Let me show you how to plant them so they'll grow." And so he gave me a lesson then in how to plant the cut bits so they could be watered and would survive, which is what happened. And we never discussed it. So that's like early memories where I have this kind of innate inner connection with plants. And then as I got older, I always say it was the hippie period, right? So when we had the hippies in the late 60s and 70s, they were going back to the land to live natural lifestyle. And I watched what they were doing, and I noticed that they kept going to the emergency room every time they had a problem, a health problem. And I thought, why aren't they using the plants around them? Aren't there plants here that they could be healing themselves with? So I started investigating herbal medicine, and that's what took me down the road of herbs. It was no personal illness. It was the hippies that did it to me.
It's an observation that they did it to you. And tell us, what type of person looking for your help?
Oh, every kind of person. So as I say, I treat people from in the womb all the way through to old age, every age group, every kind of illness that people ever have. Herbal medicine is universal medicine, right? I call it the most democratic medicine we have. Everybody has it available if they choose. It's everywhere around you in every country. It's literally universal medicine available to all people. So all people can be helped. Even if you cannot cure the condition, you could make the quality of life for someone much better. So from my perspective, herbal medicine helps everybody, every condition. It's not, what is a cure? I often ask myself, even today, I'll often sit there pondering, what is a cure? Is a cure being completely rid of a disease, or is a cure feeling great about your life? Because I've met people who suffer conditions who are extremely happy people. The condition doesn't rule their life. So are they in a good place or not? I think they're in a good place because of their attitude and their quality of life. So disease is something, I think, that can not necessarily be life-changing to be a problem for someone, and yet someone else can have a very serious illness and have a great attitude about life. So I often come down to the cure is in the mind. The herbs help you get there, but the cure in the end is your attitude. How do you think? How do you think about life? Right?
Now we're going to a very practical question. I know that I refer patient to you, but who else, what practitioner refer patient to you?
What kind of practitioners?
Yes.
And patients?
That kind of practitioner refer patient to you.
Oh yeah, every kind there is. So I work with regular medical people, functional medicine, naturopaths, dentists, right?
Mm-hmm.
Chiropractors, massage therapists, you name it. I probably have worked with every kind of practitioner there is.
Okay. And obviously, you mentioned what you think about your mission statement. Is it like you just improve the quality of patient life, or it's something more elaborate?
So my mission statement, I guess in a nutshell, is to behave and act from kindness.
I love it.
Everybody. So from my perspective, it's not about how someone chooses to treat me, right? That how someone behaves in the world is their choice. How I choose to behave in the world is to come from kindness. And regardless of how anybody chooses to behave, I get to choose kindness every time. And therefore, I'm surrounded by kindness. People are very kind to me too. It keeps coming back. What you put out absolutely comes back. So herbs are a way for me to connect with people at a very deep level and to support them in a life change. At the same time, every conversation is actually beyond even the work of the herbs. It's the conversation that we have together. That's the life-changing part. And as I always tell people, I'm part of the conversation. What I'm sharing is also for me. But what you share with me is for me too, right? So it's not like I'm the authority and you're the receiver. We're in this together. Yeah?
That's great. Can you give anybody who listening to us a quick tip that they can use for them? Does this improve their lives?
Everything. So from my perspective, if you really want to change your life, you need to pause and think about the fact that you live in this world, this incredibly beautiful world, within all of its chaos. it's still a very beautiful world, right? Nature, sunshine comes up, sun goes down. Rain comes, dry comes, winter comes. So the best approach is to honor the season, work with the season, eat with the season, eat locally. I fully believe that. Every traditional medicine would talk about eating with the season, living according to the season. And I see that most people don't do that. They eat lettuce in winter. And I'm like, why are you eating lettuce when it's snow outside? The lettuce wouldn't grow. The only reason you have it is because of modern transport or greenhouses. None of that is a reflection of nature. That's a reflection of human ingenuity. And let's face it, human ingenuity is called industrial farming, not a healthy way to produce any kind of food. Convenient, but not ideal. So my message constantly is for people to think about what would nature do? What does nature offer? How could I become closer to nature? So the other thing I suggest to people is think about their great-great-grandmother, because she was living much closer to nature and the food she produced was seasonal. She had no other choice. And yet that food was very healthy. It was in tune with nature. So pull out the old great-grandmother recipe books and start cooking, right? Every location on this planet has herbs and foods perfect for that location.
Yeah, special food for the winter.
Yeah, so only modern industrial farming allows us to do it differently. But if we were to support our local farmers, we would actually be eating a healthier food. Now, granted, they may not be farming organically, and so there is a lot of questions to ask your farmer. But there's more likelihood of getting a local healthy diet if you eat as it's in season. I'm not one of these people who believes that because of something for berries, people go, oh, I eat berries because of antioxidants. And I think, well, that's a crazy idea. That's a small reason to eat the berries. The berries come because in the season they come, they have a gift. The gift is flavor, right? I eat berries because they taste good. The antioxidants are a secondary reason. That's just a benefit they contain. But they contain nutrition. They contain the joy of the taste. They contain the season and the sunshine. So better to eat the berries because they taste great in season. And when they are in season, they taste the best. When do you get the best tomatoes? In season, right? Any other time of year, they're okay, but they're nothing like in season. So I have developed simply a lifestyle, and I really encourage everybody I ever talk to, eat in season and find out how good food tastes. Yeah.
Thank you. Thank you. It was a wonderful, wonderful presentation, and I would like to share with all our practitioners. And I thank you again, and we'll talk to you in a second.
I love it. Thank you so much, Vladimir.
I appreciate it.